Hello, everyone, and welcome to this HIV focused educational podcast developed for clinicians at DC Department of Behavioral Health, presented by Rose Chuukwu, a DMP student from George Mason University. The purpose of this podcast is to enhance clinicians' knowledge, skills in HIV testing, prevention, and timely linkage to care. The following are the agenda for this presentation: HIV overview, epidemiology and challenges, HIV prevention strategies, HIV screening, and timely linkage to HIV care. As an overview, the human immunodeficiency virus, also known as HIV, is a virus that attacks the immune system, especially CD4 cells, which helps the body fight infection. As the immune system weakens, individuals become more susceptible to opportunistic infections and diseases. Mode of transmission: HIV is transmitted through sexual contact. This is the most common mode of transmission. The next most common mode of transmission is through injection drug use, that is, sharing needles. Then needle stick injuries, and then finally through prenatal transmission of mother to child during pregnancy, birth, or child feeding or breastfeeding. Despite advances in treatment, HIV remains a significant public health concern. Approximately 1.2 million people are living with HIV in the United States. Of these people, only 45 to 55% are consistently engaged in care. Approximately 38,793 new infections were reported in the United States in 2023. HIV prevention. Routine HIV testing is essential for early diagnosis and prevention. Approximately 40% of new HIV infections are transmitted by individuals who are unaware of their HIV status. The Healthy People 2030 goal is for a 95% of people living with HIV to know their status by 2030. As of the recent data, about 87% of individuals in the United States are unaware of their HIV status. These are the current testing recommendations. The U.S. Preventive Service Task Force recommends screening all individuals aged 13 to 64 years old, regardless of risk factors. Also screening all pregnant women, including those presenting at delivery. The second risk reduction strategy consists of encouraging consistent condom use, especially among high-risk populations such as men who have sex with other men, sex workers, and transgender individuals. Screen and treat sexual transmitted diseases, which are risk factors for contracting HIV. Promoting needle exchange programs for individuals who inject drugs. Another prevention strategy is offering pre-exposure and post-exposure prophylaxis treatment. The pre-exposure prophylaxis, called PrEP, is recommended by the Task Force for Adults and Individuals at risk for HIV. Approved PrEP options currently include the daily oral medication of Truvada, emtricitabine, tenofovir, desprozel, fumarate, or Descovir, emtricitabine, tenofovir, elafenamide, or the long-acting injection, brand name Apretude, or generic name cabotegravir, administered every 2 months. When taken as prescribed, PrEP reduces the risk of sexually transmitted disease by approximately 99%. Post-exposure prophylaxis, PEP, should be administered within 72 hours of potential HIV exposure to reduce infection risk. HIV screening. There are currently 3 primary types of HIV tests. The antibiotic testing, which comes in the form of the oral quick test as the only FDA-approved rapid home HIV test, uses oral fluids such as saliva and provides results within 20 minutes. All positive tests require confirmatory tests such as the 4th generation HIV 1 and 2 immunoassays. The second type of HIV test is the antigen antibody AGAB testing. Like I alluded before, is the 4th generation HIV HIV 1 and 2 immunoassay. It's preferred test in the clinical setting. Detects about HIV, both HIV antibodies and the P24 antigen. It allows for early detection compared to the antibody test alone. We also have the nucleic acid testing, NATs. It detects HIV RNA in the blood. It can identify infection as early as 10 days to 33 days after exposure. Also used to monitor response to antiretroviral therapy because it's able to detect both the CD4 count and the viral load, HIV RNA. Timely linkage to care. According to the CDC, there are 5 steps in the HIV continuum of care that people who test positive need to go through in order to be linked to care as soon as possible and remains virally suppressed. These steps are taken from diagnosis through maintaining viral suppression. The first step is HIV diagnosis. The second step is linking to HIV care once HIV diagnosis has been confirmed. The third step is receiving HIV medical care. The fourth step is remaining engaged or retained in care in order to reach the fifth step of viral suppression and meeting the 95% goal as set by the Healthy People 2030. So why is timely linkage to care essential? It helps to achieve the goal set by Healthy People 2030 which includes 95% viral suppression among HIV, people living with HIV, 95% of newly diagnosed HIV individuals linked to care within 1 month. Linking to care, timely linking to care is critical. Immediate act, which is initiating treatment the same day as diagnosis is prepared. However, if that cannot be done, rapid acts, which is initiation within 2 weeks of diagnosis, can be done. What are the benefits to early and timely linkage to care? It improves clinical outcome, it reduces HIV transmission, and increases likelihood of viral suppression. So when delivering the news about HIV diagnosis, especially when it's positive, there's the need for clinicians to use the spike model, which includes setting, ensuring that privacy and supportive environment exists for the client or the patient. Perception, assessing the patient's level of understanding. Invitation, asking how much the patient wants to know at that stage. Knowledge, providing clear, concise information that's understandable to the patient, taking into consideration their level of health literacy. Emotion with empathy, responding to emotions, reactions with empathy. And finally, strategizing and summary, discussing the next step and providing reassurance. The next step being that, depending on the results of the testing, you might need a confirmatory testing, or if that's done in the clinical setting, treatment will be recommended depending on how ready the patient are that day. So that leads us into the case scenario for discussion. We have a 35-year-old female who presents to the clinic seeking treatment for opiate disorder, and she reports having a boyfriend but occasionally engages in vaginal activity with other male partners, and so does not consistently use condom. She expresses interest in HIV testing, which is offered at the clinic. She undergoes HIV rapid testing using the oral quick and receives a preliminary positive results. These are the following clinical consideration that I would like for you to consider and reflect on. Give me some time, and then I'll come back and complete a presentation. How would you disclose the HIV using the spike model that was just discussed? How would you explain the need for confirmatory testing? What counseling or prevention strategies would you provide? Considering her risk factors for transmission. How would you ensure timely linkage to HIV care? So I'll give you a few minutes here to reflect, and then we'll continue. So hopefully you will be using the spike model to deliver the diagnosis with empathy. You clearly explain that this is a preliminary results requiring confirmatory testing. Arrange immediate follow-up testing. Discuss prevention strategies, including PrEP, for the partners and ensure rapid linkage to HIV care and support services. In summary, achieving the Healthy People 2030 goals requires a collaborative effort among healthcare providers by improving HIV education, expanding screening, promoting prevention strategies, and ensuring timely linkage to care. We as providers can significantly improve patient outcome and reduce the HIV transmission. And here are my references. Before I conclude, I want to share the HIV Improvement Podcast posts, test, and evaluation. So if you could scan with your phone here um, to take the test, and then upon completion, you'll be able to receive a certificate of completion, which is for educational purposes, does not have a continuing education credit. Thank you for listening, and I look forward to reviewing your post, tests, and evaluation. And here are my contact information, email, and website.